What if fixing a cavity didn't require drilling, needles, or fillings at all? What if your tooth could actually heal itself? It may sound like science fiction, but researchers in South Korea are developing a breakthrough dental technology that could completely change how we treat tooth decay in the near future. For decades, dental care has followed the same basic approach. When a cavity forms, the decayed part of the tooth is drilled out and replaced with an artificial filling made of metal, ceramic, or resin. While this method works, it does not heal the tooth. It only covers the damage. Now, scientists believe they've found a way to activate the tooth's natural repair system. South Korean researchers have created a biodegradable patch, or gel-like material, that can stimulate the tooth to regenerate damaged tissue on its own. Instead of filling a cavity, this patch encourages the tooth to rebuild itself from the inside. At the center of this innovation are special bioactive molecules, including peptides. These molecules are designed to penetrate the tooth and send signals to stem cells located deep inside the dental pulp. Once activated, these stem cells begin producing new dentin, the hard tissue beneath the enamel that makes up most of the tooth structure. In simple terms, the patch wakes up your tooth's natural repair crew and tells it to start fixing the damage. The process would be surprisingly straightforward. First, the dentist cleans the decayed area just as they do today. Then, instead of drilling deeper and placing a filling, they apply this thin biodegradable patch to the affected spot. Over time, the patch dissolves safely, while the bioactive molecules stimulate the tooth to regenerate lost tissue naturally. No drilling, no permanent artificial material, and potentially far less pain. This matters because traditional fillings don't last forever. Over time, they can crack, leak, or fall out, often requiring replacement. Each replacement removes more natural tooth material, weakening the tooth over the years. Regenerative treatment could help preserve the original tooth structure for much longer. Another major advantage is reduced inflammation and lower risk of complications. Because the tooth is healing itself rather than being filled with foreign material, the body is less likely to react negatively. This technology could also make dental care more accessible worldwide. In many parts of the world, advanced dental procedures are expensive or hard to access. A simpler regenerative treatment could reduce costs and make early cavity treatment easier and faster. At the moment, this dental patch is still in the preclinical research stage. That means it has not yet been widely tested in humans. However, researchers are optimistic. If upcoming trials are successful and regulatory approvals move forward, this technology could reach dental clinics within the next few years. Experts say this is part of a much larger shift happening in dentistry. Instead of focusing only on repairing damage, scientists are working toward regenerative dentistry treatments that help the body heal itself. Around the world, researchers are also studying how dormant tooth-forming cells might be and how stem cells could one day help regrow entire teeth. While full tooth regrowth is still a challenge, technologies like this patch show that partial regeneration is already within reach. Of course, there are still hurdles to overcome. Scientists must prove the treatment is safe, effective, and reliable across different types of cavities and patients. Long-term results also need to be carefully studied. But the direction is clear. Dentistry is moving away from drills and fillings and toward biological healing. If this South Korean innovation succeeds, future trips to the dentist could be quieter, gentler, and far less stressful. A future where cavities heal themselves may not be far away. And when that day comes, the sound of the dental drill might finally become a thing of the past.